is your take on salt? Do you agree that one should have it in the diet or should aim for a low salt or even a salt-free diet? Because salt is very pleasurable, and that's one of the things you talk about. So,
Yeah, salt's an interesting problem, and I think that in I call our arena the hyper health arena. In other words, it's not just interested in health; it's people that are really interested in health and are very, very knowledgeable. So this is a little bit controversial in the hyper health arena, and so I can run the gamut. So Dr. McDougall is not that concerned about salt, and the reason he's not that concerned about salt is that he's so much more concerned about getting the general direction correct.
that's right.
So he's interested in getting all the oil out of the diet. He's interested in getting the animal food out of the diet. And so that's what he's interested in. And so if people need to sprinkle some sugar and some salt on their food in order to make that happen, he figures like he's winning 95% of the battle and he's not worried about the last 5%. So that's McDougall's position, and it's very reasonable. Okay, there are people that for example, that may have hypertension, and they may not do as well on that kind of a diet as if you go all the way to the floor. So Goldhammer, Dr. Goldhammer will not use any salt in his diet at all, other than the natural sodium that's in there.
Right.
And you will see the most dramatic effects in hypertension with the Goldhammer diet. So it will be one notch superior in outcome to the McDougall diet. However, that's a short-term effect because we should check them a year later to see who's still doing it. Okay, because Alan Goldhammer's recommendations are going to be more difficult to follow, and therefore it's going to be probably more likely that people will toss their hands up and forget it. Okay, now interestingly enough, there are many people that I have met that when they have gone all the way to a completely whole natural foods diet with no added salt at all, after a period of a few months, they can acclimate to that, and then they don't want it any different. Okay, which is interesting. Also, an interesting sidelight is that it appears that the inclusion of sodium in the diet is a reason for for I think unknown reasons at this point, but it appears to disrupt sleep. And it probably does so because you probably become thirsty, okay, in a way that you wouldn't if you were not eating sodium. So the little alarm bell goes off inside the head at 3 in the morning, and it will actually wake you up. So when Alan found that out, he was very happy about this because that gave him an argument for his position. I think these are relatively minor issues, unless you happen to be someone with very high blood pressure. If you're with very high blood pressure, sodium causes you to retain water and therefore contributes and exacerbates high blood pressure. But if you are not somebody that's specifically dealing with high blood pressure, also even if you don't have high blood pressure but you have a severe cardiovascular condition, you've had a couple heart attacks, you've had 2-3 stents put in, and you're short of breath and you're in congestive heart failure, you may not have high blood pressure, but you are taxing the system by having extra sodium in the diet and therefore extra fluid in the cardiovascular system. So for severe cardiovascular cases, which include high blood pressure, I would say the less sodium added, the better. Anybody else, I would say minor issue. It's not something that I worry about, at all personally. I have my food is salted to the level that I like it, which tends to be a fairly low sodium diet.
Right.
But I'm not fastidious about it.
Yeah, I think salt's an interesting one, and it's one that I've been very interested in myself. Yeah, I think as long as folks can go towards the lower end, I think most people are going to be safe. So.
Yeah, the big problem is that when people are into very salty diets, those are salty and greasy.
That's right, yeah.
And so they're just by the very nature of headed towards a healthier food, you will, as you get used to diets without all the grease in them, you'll be moving towards a lower sodium fare, and then I think it kind of takes care of itself.